Madhurja?
Yes, ma'am.
Yeah, did you find out the comments?
Yes, ma'am.
So, I mean, did you understand what I was actually saying?
Yes, ma'am.
Okay, so basically, I'll just open the file till the time this people comes. Can you tell me the comments what I told you to do?
First one was, why don't you write some Indian scenario?
Yeah, so over there, what you have to do, like from which particular countries the flow is more. So you have to write that. So and also you have to write in which of the hospitals the patients comes more. For example, Apollo Indraprastha Hospital used to have a really good patient flow from outside, and Fortis used to have, and then like some other hospitals. I mean, if you have to research about it, get the data from secondary, find out in which hospital the flow is more, and from particularly from which country they are coming. So that you can put inside the introduction. Okay.
Yes, ma'am.
Yeah. What else was there?
And second was, mention about the other healthcare services that are affected during this pandemic.
Yeah, so other services in the sense you can just talk about other healthcare services. You can talk about M Health, right? Just because of this reason, because of COVID-19, this is actually increasing. Uh, Use of M Health is increasing. So some of the scenarios, just check it from net and then find out from secondary what are the other services which has been also affected, not only the this one, what is that, medical tourism. Okay, so just
Yes, ma'am.
find out things from secondary and put all those things. And
Okay,
if you
ma'am.
once you finish it, just send it back to me, I'll check it again. And also, you people just don't copy paste it, because it looks really bad when you copy paste things. Try to give some human touch. You people know how to form a sentence, read something and you want to put the same thing in your research document. What you can do is you form your own language and then write it. Just write something. It will be good for you, like in the sense, for your communication purpose also it will be really good for you. And your sentence formations will be better, right? So that is the reason
Yes.
I'm asking not to just copy paste. I would suggest you to read those papers, get insight from them, from the papers, and then write accordingly. Use your own sentence, give a human touch to it. Okay.
Okay, ma'am.
Yeah. I suppose almost everyone is there, or who else is? I think Nivedita or someone is not there. So Dipanjali is there, Joydeep is there, Madhurja, Naeem, Nawaz, Rahul, and Ardhavanki. Okay, so I'll just start. Mm, Let me know when you can see my screen. Basically, this is from SlideShare. I did not prepare any PPTs. Already you have it, so you prefer from, like, you just refer to those only. But it is just a base that you would understand how a nursing unit is planned and how a nursing unit should work. Okay, can you all hear me?
Yes, ma'am.
Yes, ma'am.
So
Yes, ma'am.
it's all about planning. It's
Yes,
We are
ma'am.
talking about how to plan something. So it is a process of determining the objectives of administrative effort and devising the means to calculate to achieve them. Yeah. So planning is something like first you define an objective and calculate your steps how to achieve that thing, that particular objective. Okay. So in research also you do the same thing. You find out your objectives at the first point itself, that what you're gonna actually find out from the study, right? Like if you like Madhur's topic, if I am telling, so he wants to find out how COVID-19 is affecting medical tourism, right? So the objective also should be nearby, what you particularly want to find out, and the same answer should be given through analysis, and in the conclusion, the same answer should come out. Okay, the questions which will be laid out in the objective, that has to be answered through your analysis, and through your conclusion, that same answer should come out. So next is that so what is I mean like it is a continuous process. Planning is a continuous process. What are the steps included in it? One is that you first set a goal and the objectives, and then lay out the plan of action. You just plan it accordingly in your head, or you put it out in a paper. Plan it how you have to do. We are talking about the nursing unit plan. So in that, how a nursing unit should work, so that plan should be done before, and then we will implement it. After implementing it, sorry, it's not going. Sure, sorry. What is the step? Maybe you'll review it. Yeah. So once you will implement it, you will be reviewing it, and then take a feedback, and once after feedback you will do the modification accordingly. Okay, this is just a plan, you no need to follow, but this is just a normal thing. Basically we'll be going directly to the nursing unit. So in nursing unit, a ward is that area of the hospital where all amenities like physical, social, and especially medical care are made available to facilitate patients' treatment and make the patients feel at home till they are discharged. Okay. So like basically nursing unit is only the wards. Okay. We are not talking about ICUs and critical care units. So it is only about the wards. Okay, so how it has to be there in the hospital. So in order to in other words, the ward is a temporary home for the patients admitted there in the hospital. Okay, so do you know what is the hierarchy among the nurses? Can anyone tell me the hierarchy of the nurses?
Ma'am, nursing superintendent is the highest.
Is it? Is it?
I guess so.
No, it is not that one, because it depends. Okay, it depends upon the hospital. So if the hospital is very
Staff
much
nurse.
bigger, no. Dipanjali wants to say something. Just tell me.
Ma'am, in different categories, the everyone is divided according to the need of organization, starting from the superintendent to the staff nurse to the general nurse, everyone. That is maybe, ma'am, I don't know.
Okay, so you don't have a clear idea of it. So basically,
Ma'am, chief nursing officer.
Yeah, chief nursing officer is the one. Then I mean, like it is basically for the hospitals which is having more than 500 bedded hospital. Okay, but less than that would be having nursing superintendent. Who said this? Nursing superintendent.
Ma'am,
Naeem, yeah. So for the people, for the hospital who are having less than 500 or so and so beds, like 250, 150 or like that, those people will be having only nursing superintendent over there. They are the only person who would be the head of the department. So basically, once after chief nursing, your director of the nursing comes. Once the after under the director of nursing, there will be nursing superintendent. Okay, so in the bigger hospitals, then under the nursing superintendents, you will be having the staff nurses, registered nurses. In the sense, in staff nurses you would be having ANMs, you would be having no, sorry, ANMs will not be preferred. You'll be having GNMs, you will be having BSc nurses. Okay, and some of the hospitals who are really small, in that ANM they takes, but ANM does not have the particular, what to say, in a bigger hospital and emergency setting, ANMs cannot practice actually. So then the lower one is the staff nurse, and they would be having GNM degree or BSc. Okay, you got it now?
Yes, ma'am.
Ma'am,
Yes, ma'am.
Yeah.
ma'am, what is matron?
Matron is a nursing superintendent. You call them as matron as well. In some of the organization, people will be calling them as matron. In some organization, they will be calling them nursing superintendent. Okay.
Okay.
Where last time, I would tell you a story. Our students were there. I mean, like with me, there were other people also who did something else. I mean, like they were not from healthcare background. They did BCom, or some of them they came from some different background. And those people, we actually had to make a plan for salary division. Okay, so in that they have put matron, and they have only given 15,000 of salary. Can you imagine a matron is giving 15,000 of salary per month? So I asked them, why did you give 15,000 for matron? They were thinking matron is something who is just similar person who is from housekeeping. Okay, so so basically, people who are from other department, other areas, they don't really know what matron is, and what, I mean, like there will be other designation also, they will not be knowing about them. So then I explained them that it's not the person what you're thinking. They are the nursing superintendent. You also called it as matron. So we would have to give more salary. You cannot just put it like that, then whole calculations will be wrong. Okay, so you have to remember that matron is a nursing superintendent. Okay, so planning of a okay, so do you know what is did I tell you before what is the patient and nurse ratio before? Did I tell you, people, in all the units?
No, ma'am. That day you just asked about ICU
Okay.
ratio of nurse.
All right. So I explained you, right? In ICU, it's 1:1, and it depends upon the organization. Sometimes they used to put 1:1.5. Okay, but standardized is 1:1, and in the wards it is 1:6. Nowadays, and like most of the government hospital, they don't follow it. There are hospitals like PGIMR, so those people used to have even 15, 1:15. But in the standard says that you always have to keep 1:6 or 1:5. Okay, in specialized ward, you have to keep 1:5. And in HDU, HDU is a high dependency unit. Over there, you would be having 1:2 or 1:3. Okay, so this is the actual standard which people follow. So, planning of a nursing unit, as planning is put into action, the management functions of organizing, leading, and evaluating are implemented, making all unit management functions interdependent. Yeah. So you know that all the departments which are there in the hospitals are interdependent to each other, right? So like our nursing department will be interdependent to the housekeeping department, and they will be interdependent to the dietary department. So each of the departments will be relying on each other. Okay. So principles of planning health services. I don't think it is needed, but I'll just skip it. Okay. So over here, the implementation of the overall plan for the nursing department provides for the establishment of a number of units or departments, each charged with the responsibility of accomplishing some portion of the plan. Okay. Head nurse, assistant nurse supervisor is in charge of small individual nursing unit. So assistant nurse supervisor or a head nurse will be a small individual planning. They will be seeing one small individual nursing unit. Like for example, HDU is a high dependency unit. There one head nurse will be there. Okay, one assistant nurse supervisor will be there, who will be looking after the duty roster of the nurses, who would be looking after the assignment in the sense which patient to assign, who would be also looking after the logistics of the organization of the particular department, and she would also train the nurses. So did you understand the roles and responsibility? Now you just tell me what is the role and responsibility of that particular supervisor who plans who supervise a nursing unit. Just tell me the roles and responsibility.
Ma'am, the supervisor will allocate the staff according to the patient.
Yeah.
And in the means at the correct time patient have get their medicines or not. And ma'am, sometimes suppose the supervisor have some nurse have some confusion regarding medicine or indenting or anything, she have to solve. Or may some attender may complain of anything, means or patient that they are not satisfied something. So first of all, the staff nurse will tell the supervisor to look over.
These are small functions which every head nurse has to do. But particularly,
Yes,
if you just remember what you have to write in your exam, is that the plan of duty roster of the staff nurses, and the assignment of the assignment of the nurses, which patient to look after, and planning of logistics and managing them. Logistics, you understood what I am telling? In every particular nursing unit, you would be having some of the logistics to run the particular unit. So for example, where I was working, it was called HTU. So basically for a week, they used to get budget of 12,000 to run the particular unit. So in that unit, in that 12,000, you would invent some of the emergency medications. You would invent papers which is needed for writing. You would invent all the documents which are needed for files, and you would invent housekeeping material, all those things. Okay, so they used to get particular these head nurses used to actually manage all those things. Okay, so that also is a responsibility of nurse. Okay, or handling any internal issues. Okay, these are the biggest responsibilities which a head nurse or an assistant nurse supervisor has. So there are groups. Okay, like we only don't have nurses in our unit. What would we have? we would have staff nurses, we would have one head nurse or a assistant supervisor, we would have the non-professional workers like the clerks or the housekeeping personnel. So I mean, did you see any, I mean, like, so can you people tell me what are the responsibilities for housekeeping people in a particular department, not in whole hospital, in a particular department? What are the responsibilities of housekeeping?
Maintaining cleanliness and hygiene.
Yeah. So that is, you know, that is the whole thing. So break it down. Just tell me small stuffs what they do.
Ma'am, helping the patient
Mm-hmm.
to
Yeah.
to take
Go
them
to
to the
washroom and
washroom.
all. Yeah.
Yes, ma'am. And sometimes to the procedure. Suppose patient had to go for MRI or CT in wheelchair, they used to take. And ma'am, sometimes they used to provide cloths and all to the patient, means cleanliness, that only bed and all. And ma'am, some of the organization, they divide, some are housekeeping and ward boy and ward girl. So responsibility for both are different. It's depend upon organization, I think so, ma'am.
Yeah. So basically, you know, okay, so there is a question. So bed, who actually has to prepare the bed of a patient? Who has to prepare?
Ma'am, where I worked previously, there to nurse and housekeeping both together.
Yeah, so it is actually in the job description of nurses, it is mandatory that they are the one who has to do the job, bed making for the patient, because there are techniques of making a bed. There are things which is very much important, which has to be kept in your mind while making a bed. There should not be any cringe. There should not be any what to say, single line in the bed. Yeah, beds, so that might lead to bed sores, right? So it is a responsibility of nurses to inspect the bed and to make the bed for the patient. Nowadays, actually, nobody is practicing. In most of the private hospitals, super nurse housekeeping people are doing it. No nurses does it, but it is a responsibility of nurse particularly that she or he should make the bed for patient. All right. So, staff nurses at their level to take part in the process of planning, for example, daily planning related to patient care, including history taking, assessment, and nursing diagnosis. Okay, we understood about head nurse and assistant nurse, supervisor's responsibility. Now, what are the responsibility of staff nurses? Okay, so staff nurses are basically responsible for taking the vitals of the patient, taking their histories if they have any histories. Most of the time, the doctor only used to take the history, but it is also their responsibility to take the histories. Like, for example, what kind of food allergy she has or he has, and what medicine she is allergic to, and or previously she had got any reaction, or earlier did she had any what to say, any fall or any um, admission, like if she got admitted to any other hospital, or ensuring the all the files are there with her, all the documents which is needed for current diagnosis is there with the current patient and all, and she has to ensure all those things, and she has to do the assessment for the patient. Whole assessment she has to do it. And basically nurses also does nursing diagnosis, that you might be knowing. There is in the documents, did you see any like what nurses used to document in the file of a patient? Did you people see, any of you?
Yes, ma'am, I have seen.
Yeah, you of course you would see.
Yes, ma'am.
What about others? Who's that, Madhurya?
Yes, ma'am.
What did you see? What they used to write in in the documents. They used to all the time write. I mean, like more. I would say nurses are more time with the papers than doing the care for the patient, right?
Yes, ma'am.
So what are the reasons? What they used to write in the papers? I suppose it has to be only patient care, but what they actually write in the papers?
Actually, they write everything like timely advices from the doctor,
Mm-hmm.
and then what medicines are provided at what time,
Mm-hmm.
BP,
Hmm.
timely BP,
Hmm.
and blood sugar level.
Hmm. So accumulating all that you can call as
Yes,
vital. So they
ma'am.
check
Yes,
for
ma'am.
the vitals. Okay, they check
Yes.
for, they write down the vitals. If it is ICU, they do it every hourly. If it is HDU, they do it every 2 hourly. If it is a ward, they do it thrice a day. Okay, so vitals are taken in that way, and also they have a format of nursing assessment. Okay, so in that assessment form, what they have is, first they will be planning, like the steps of assessment. First is the planning. Okay, what is that? Dipanjali, can you tell me the assessment which nurses takes?
Yes, ma'am.
Yeah, tell me. The sheet they used to have, and there particularly it is written that you have to do it in this way.
Yes, ma'am. Ma'am, the planning, then the procedure, if anything planned,
Mm-hmm.
then ma'am, the medication,
Mm-hmm.
then ma'am, the patient, the food patient have taken through Riles tube or orally, what the way
Mm-hmm.
patient passed stool or not.
Mm-hmm.
Then ma'am, some color codes type, some the patient is
That is there in the,
vulnerable,
yeah, yeah, yeah.
patient is vulnerable, patient is responding or not. Then
Mm-hmm.
if means weakness is there, that is on which side. Then
Okay.
patient regularly passes to urine
Mm.
or not, the total
Okay.
urine.
Yeah,
And ma'am, the diagnosis also they used
yeah.
to do
Mm-hmm.
one diagnosis from their side.
Yeah, one diagnosis
uh,
from nurse's side. Yeah. So,
and
okay,
any
whatever you
future
said
planning,
is
the
right,
next.
completely right. Did you see any care plans for nurses? Did you see any care plans particularly?
Ma'am, care plan will be like this. Now, if the patient is a neurology patient, then we have to take care for bed sore.
Mm-hmm.
Physiotherapy has to be do that
Mm.
one.
That is, yeah, that has a particular format. Do you know about the format?
Oh, no, ma'am. Exactly, I
Okay,
don't
so
know.
basically, first they would be doing Disney, sorry, Disney, I said. So first they would be doing assessment, and then after that, the nursing diagnosis comes, and then outcome comes, okay? And then intervention comes, and then rational and evaluation, okay? So this is the form they have. I mean,
Yes,
like
ma'am.
in most of the hospital, it has, I mean, private hospitals and those who are accredited, they have to follow this, even if
Yes,
they are
ma'am.
not even if they are not doing anything, they have to fill it. Okay, so in the assessment they
Yes,
can
ma'am.
write whatever the person is having, whatever current problem the person is having right now. For example, dyspnea. Okay, for example, a person is having difficulty in breathing, or a person is having a difficulty, restlessness. So in diagnosis, accordingly she will write what kind of diagnosis would be there for this patient. Okay, an outcome, what will be the outcomes, she has to decide by herself, that she has to settle down the patient, and the patient who should have a good breathing pattern, she has to establish that. And then in the intervention, what she has to actually do, what she has done for making the for what is that, for caring dyspnea, whatever she has done, that she has to write in intervention. And in rational, she has to write what actually happened. I mean, like if you gave some kind of care, what happened with that care. And then at evaluation, the current status of the patient has to be written by the nurses. So this is the particular format for the nursing care plan. Okay, so if in case any time when you go to hospital, you should not be You should not be like, oh, I don't know what these nurses are writing in the papers. You should always know about it, because sometimes you might go as a supervisor also. You can just go and check out what these nurses are doing, whether they are doing proper documentation or not, because on documentation there are a lot of question marks that if you are not filling it properly, you might go to, I mean, like, you might face a legal uh, problem, right? For example, think that you have given a medication right now, okay? Just before sometimes a medication has been given by you. Now the medication has like, once after taking the medication, the person adversely reacted to it, okay, but she did not documented it, she forgot, and her shift got over, she went off to home, and like, everyone was wondering who is the person who has given the medication, when the person is right now suffering from the problem. And now the supervisor would be calling the previous nurse who completed her duty. uh, she said that nobody has signed in particular medication, like, who has given the medication, nobody has particularly written it. So just tell me the explanation, what kind of medication you have given. Now if you don't know what kind of medication you have given, and the adverse effect, you cannot improve, right? Without knowing what is the cause, you cannot treat the patient. Just because of these reasons, you always have to ensure yourself that the medications chart and the documentation part of the nurses has to be very much clear, so that no trouble occurs in the no trouble occurs for the patient. Okay, did you understand it? All right.
Yes, ma'am.
Yeah. So points to be kept in mind for unit planning. Matching the people jobs, patients assignments, patient assignment distribution among nurses. Yeah. So while planning it, you also have to understand the planning. So now while planning, you also have to understand the distribution of the nurses. Now you have 30 beds in your unit. So if you take as 1:2, how many nurses should be there in the particular unit? You have to plan those resources accordingly, okay? And developing policies and procedures specific to the client's care, for example, procedure manual. Yeah, so you all has to know that every procedure has a manual, starting from the bed making and up to the time, up to the tracheostomy procedure, okay? Every procedure has a manual. When you go to hospitals, you have to see those manuals, okay? So these manuals are actually the performer that you follow when you perform something, okay? You have to follow each and every steps, whatever it is written in the particular format, and you have to do it accordingly. It might be Dipanjali, you have seen, right? Those procedure manuals used to be there for bed making, for medication administration, ET tube insertion, for urethral tube insertion and all, and Ryle's tube insertion, right?
Yes, ma'am.
Yeah. So you all, when you go to hospitals, you also have to look after these procedure manuals. Whatever, if it is available in the wards or if it is available in the particular unit, go to the head nurse and ask for it. Though some of the people who are not from healthcare, they will not understand anything, but I would suggest to see it. Okay, you'll get much understanding. And then, okay, so once the meeting is getting finished, you people can join it again, okay? I think 5 minutes left for finishing it off. Yeah. Prepare and identify training needs, regular ACLS classes. So tell me, what is ACLS? Dipanjali, don't say. What is ACLS? Anyone knows? Or okay, leave about ACLS. Talk about BLS. Do you know about BLS? What is BLS? Now I would ask, tell me, what is BLS?
Ma'am, basic life support.
Yeah, who said this?
Rahul, ma'am.
Good. Okay, I never expected Rahul would speak. Okay, good. So like that, one another form is there which is called as ACLS. So what is that now? You people don't know? Write it down somewhere, okay? It is advanced cardiovascular life support. Okay, write it down somewhere, otherwise you'll forget, or you can just search it and net also, you'll get it. So basically in BLS we only use we use manual things, but in ACLS we use all the we use medications, we also use what is that, defibrillator to revive the patient in normal situation. Okay, so ACLS is a little tough one, so they also like the all the nursing personnel has to know about it, and because when there is a code blue, they have to perform this. So that is the reason all the nurses and the doctors has to be very much experienced in ACLS. Okay, BLS is known by everyone. All of you people, maybe you will be knowing about BLS, right? So that is that is not important for the people who are working as a healthcare providers. They have to know about ACLS. Okay, so preparing and conducting training programs. Yes, not only about ACLS, they have to give training about BLS. They have to give training about management. I mean, like management of a particular unit. They have to provide training regarding procedures. These procedures which we talked about, procedure manuals. So that training, those training also we have to give, and also about the fire and safety trainings. All these trainings has to be given to the nursing professionals. And coordinating all the patient care activities by coordinated making of duty roster, patient assignment, and class arrangement. Yeah. So do you people know that not only the nursing students has class, but the people who are working as a staff nurse, they also have classes? Do you know that? Do you know that?
Yes, ma'am.
Yeah, so basically in a hospital, private hospitals, all the private hospitals are performing this right now. The staff nurses has to go through some classes, and they also have to give exams on it. It is about the procedures, it is about the fire and safety and other classes, other things. Okay, so they have to go through the classes and they have to give exams. So training come classes. And now the meeting is going to finish. I'll start again. All of you has to come, okay? Whoever attended it.